All right. Well, welcome everybody. It's a privilege to be with you. I'm Dr. Paul Winterton. I'm speaking to you from the beautiful Rocky Mountain state of Utah, the Wasatch Front. I'm an orthopedic surgeon, board certified, and I'll go through. I represent Joint Regeneration Center of Utah. I have been in the operating room all day, but I am strongly focusing as the second part of my practice in non-operative modalities. I am a graduate of Harvard Medical School in the class of 1993. Interestingly, in 1993, there was very little discussion provided us about stem cells, regenerative biologics, exosomes, and so much has happened since 1993. I've been in this space for about 15 years. I did my orthopedic training at the Mayo Clinic, and there we spent a lot of time doing operative management and did a little bit of work on regenerative biologics in an attempt to treat things non-operatively. But we've come a long way since I graduated from there about 25 years ago. I am on the board of the American Academy of Orthopedic Surgery. And we are now in an aggressive approach to managing musculoskeletal problems with regenerative biologics. I just spent 72 hours in Las Vegas, Nevada, here in the United States, with about 500 specialists with regenerative biologics. I participated with the meeting, and what you're about to hear is what I would consider the standard of care worldwide. So welcome to the classroom. Let's get started. We'll be talking about ways to lubricate the knee. We'll be talking about platelet-rich plasma, where we take platelets from your blood circulation, concentrate them to 10 times and 5 times the concentration. We'll be talking about the parts of your blood that don't have platelets, platelet-poor plasma. And there's a profound protein, a macroglobulin present there, that is alpha-2 macroglobulin, that is a profound anti-inflammatory. We'll be talking about exosomes and cytosomes. These are better known in the academic world as extracellular vesicles. These are the molecular sized blebs or bubbles that break off from the stem cells and communicate with your own cells. We'll be talking briefly about freeze-dried material that are harvested from patients who donate their bodies to be utilized. The little capillaries or mini vessels in your fat can be freeze-dried and injected in joints, and that helps increase the healthy vasculature inside joints. We'll be talking about bone marrow aspirate concentrate that we can get from patients, their own body, and also talking about placental-derived stem cells or mesenchymal stem cells, or even more appropriately, medicinal signaling cells. So let's start first with the most important thing. When patients come to our office as specialists, they talk about the chief complaint of what's bothering the severity of what's bothering them, duration, and particularly functional loss. And for those who are listening, it's very important for you to focus on this either as physicians or as patients to be able to clarify how bad is it bothering, how long has it been bothering, and how it affects your function. Stem cells. These are infant cells. And what is a stem cell? A stem cell is an infant cell. That's not a baby cell. That's a cell that comes from your marrow or from the placenta that is delivered, or the umbilical cord. Stem cell or a medicinal signaling cell is capable of self-replication and is capable of differentiating into a mature specific cell line. So let's start with ways to preserve joint space. And I know some of you are tuned in for spine. This doesn't apply to spine. However, we can inject into joints like knees, like shoulders, ankle, viscous supplementation, also known as hyaluronic acid. And we can inject this lubricant into the knee and it decreases the coefficient of friction. And if you've got an irregular joint, we can't do this in spine, but we can do this in joints. And we do this by direct injection under fluoroscopic guidance. And we can do this in our clinics in Guadalajara. And I think at the end of this talk, we'll have to talk about what clinics are available in Guadalajara, Puerto Vallarta, Cabo San Lucas, and Cancun. But this is my clinic in Salt Lake City, Utah. With cartilage damage, the joint surfaces become very irregular, and we're able to inject lubricant into the knee to help decrease the breakdown of cartilage with that irregular material. And maybe talk about knee osteoarthritis. Osteoarthritis is an inherited disease where the cartilage is more vulnerable or less durable, and it's usually due to collagen crosslinks within that cartilage. Let's talk about PRP, platelet-rich plasma. Platelets can be drawn from your peripheral blood source, can be separated with centrifuge into platelets. We discard the red blood cells and we take the platelet-poor plasma and the platelets, and we're able to inject those. Platelets are teeming with growth factors that help regenerate damaged tissue. That would be in and around the disc of the spine, in and around the facet joints of the spine, and some of the ligaments around the spine. And those 30 growth factors can help regenerate, number one, and number two, help decrease inflammation. We're able to separate all of those separate blood products. And this is what it looks like before we inject. To the left, we have the platelets that are 5 times your blood concentration. In the middle are platelets that are 10 times the concentration. And then on the far right is the platelet-poor plasma. Platelet-poor plasma has a very important substance in it called alpha-2 macroglobulin. It's a protein, it's a globulin, and profoundly effective in decreasing inflammation. We used to just discard the platelet-poor plasma, but now we're able to provide that. And we're able to take that platelet-poor plasma and remove the water in it and concentrate that globulin called alpha-2 macroglobulin. Okay, on to something more exciting and materials that are available from the platelet or from the placental-derived stem cells that are available in Mexico. Now, it's very important to report to you that in the United States currently, there are only 2 states where you can get placental-derived stem cells. In the United States, we cannot culture and expand those stem cells. That only can be done in places like Mexico and Colombia and Panama, Costa Rica, and other places, the Cayman Islands. Let's talk about this material that we call exosomes and cytosomes. They are molecular-sized bubbles that are procured and are available from stem cells. And these are little bubbles that can communicate with your damaged cells in your disc and communicate with the damaged cartilage. They have receptors that can attach to your own cells. They are procured from the umbilical cord. And here you can see stem cells that are in the umbilical cord can be procured, and in Mexico or in other countries, cultured and expanded to provide millions and millions of stem cells. This is what an extracellular vesicle or cytosome or exosome looks like. In scientific terms, these are lipid bilayer structures that are teaming with mRNA present inside the vesicle that can attach to your cell and can tell your cell to become young again. It's very exciting. This will let you know these little bubbles that can bubble off do not have nuclei, do not have DNA, but can attach to your cells and make them young again. That is your cartilage cells or disc cells. They have receptors that are similar to Velcro where they purposefully attach. And here you can see how target cells can, the vesicles can come from stem cells and can attach to your damaged cells and make them young again. It all has to do with DNA. The older we get, the older that disc gets, the older the facet capsule or cartilage gets. The DNA in that disc have stopped producing the cushion, stopped producing the materials necessary for a healthy disc. And these stem cells, or what we call medicinal signaling cells, can provide communication through these little bubbles called cytosomes to attach and actually turn on the DNA that's become old. For those scientists, this is all the process known as replication, transcription, and translation. Translation is when your cells make proteins. Transcription is when your cells replicate the DNA. And of course, the cells can replicate through mitosis. Regulation of transcription, that is regulation in the cells of the DNA duplicating, is a carefully monitored process. And stem cells that you can inject locally or through IV can significantly affect the process of transcription and post-transcription or regulation, that is the making of proteins through the process of translation. Here's a vial that we have available in the United States. This particular vial comes from St. Louis, and we're able to procure these extracellular vesicles from umbilical cords and placentas. These are cryopreserved until they're ready to be injected. Another company here in the United States called New Life Medical Services in Tampa Bay, Florida, also procures medicinal grade placenta and umbilical cord and is able to come up with this. This is the small vial. Typically in this vial, there are 850 billion, that is billion, not stem cells, cytosomes. Again, those are molecular sized bubbles that can communicate to your dying or near dead cells and make them young again. Okay, let's talk about IV injection. You not only can inject the stem cells in and around the damaged areas, you can also inject them IV. Stem cells, that is medicinal signaling cells with nuclei, do not cross the blood-brain barrier. They go to the right side of the heart, and then they're distributed throughout your entire body. These products must be preserved in minus 70 degrees Fahrenheit before they are injected. Okay, briefly, when people donate their bodies to be used as graft or bone or hearts or lungs, people do donate their fat, believe it or not. And that fat can be freeze dried, and those vessels can be injected after they're taken out of the freeze dried form. It can be injected directly into joints to help increase the vascular supply, restore the healthy vascular supply in and around joints. Let's talk briefly about what is available worldwide, where we can take patient stem cells from their marrow, from their pelvis. This is a very well recognized, world accepted standard of care for places where stem cells from placentas are not available. In the United States, currently, stem cells from placentas and umbilical cords are only available in the states of Washington and Utah. The FDA has not been helpful in developing this technology in the United States. That's why we have all of these clinics worldwide. I would say Mexico and Guadalajara are 40 years ahead of the United States in the technology and application of placental derived cultured and expanded stem cells. In the United States, we are allowed to take marrow from patients' own pelvis while they're awake, and we can take those marrow cells, culture or not culture them, but we are able to centrifuge them and inject them in and around the spine. Here's an important bit of information. 95% of the recipients of bone marrow stem cells are patients with spine symptoms. 95% of the application worldwide of regenerative biologics are focused on lumbar and C-spine and some thoracic. And here's another view. While patients are awake, we're able to pepper the bone to numb up the bone so we can go in and take out stem cells from their marrow if patients want that. Of course, patients who don't want that come to our clinics in Guadalajara and Puerto Vallarta, where we're able to give them placental stem cells. In the United States and worldwide, we're able to, following procurement, centrifuge these cells to give them the concentrated stem cells from these areas. And these are just some samples of the centrifuges that we use. And we're able to take those and inject them. Okay, let's talk about the spine. C-spine and L-spine. It's very important, and if there's anything you leave this talk with, is understanding that you don't have to directly inject into the disc. Our spine, our human spine, is surrounded with vessels that if they have stem cells that are injected anywhere near the posterior or rear aspect of the spine, those what we call perivertebral lymphatic vessels deliver those injections directly into the disc, directly into the facet once they're injected. So we don't need to inject these directly into the disc. These cells know where to go to decrease the inflammation and to help regenerate disc, facet, and ligaments. Okay, let's talk about placental-derived stem cells. This is a placenta. A placenta has a part that is from the mother and a part that is from the fetus. These placentas that are delivered full term by highly vetted women who donate their placentas. Now, interestingly, the placenta is the master command center to tell a developing embryo which tissues to become: heart, lung, joints, disc, central nervous system. So it stands to reason that after the baby is delivered via C-section, we have these extremely valuable, extremely potent stem cells or medicinal signaling cells that we can harvest. In the United States, we can take stem cells from the umbilical cord and placenta and gather about 8 million concentrated stem cells and inject them. They stay alive. The process is about a 6-hour process. Again, in the United States, we are not allowed to culture and expand them. In Mexico and Panama, we are able to culture and expand the stem cells to create vials with 50 million, sometimes 100 million stem cells, or billions of exosomes that can be injected in different parts of the body. It's highly structured, highly, this is the same process that's used worldwide and highly regulated and standardized in how we are able to select the patient donor and get all of these stem cells expanded and cultured. In our labs in Guadalajara, L cells, you'll get the uh, email address for this. It's a mesenchymal stem cell bank in Guadalajara, and it's from these cells in Guadalajara that are cultured, expanded, placental-derived stem cells, and then cryopreserved. We have confirmation of 85–90% viability of these cells post cryopreservation, meaning they're frozen and it's a serial freezing process. Be assured that these products that are created are done in highly sterile environments during the culture, expansion, and cryopreservation. The particular number of cells here in our labs in Guadalajara are carefully counted to when you pay cash for these stem cells, you know exactly the number that you'll be getting injected in and around your spine or joints. Typically, large joints like the knee are injected with 50 million medicinal signaling cells. In the United States, we can only procure and inject about 6 to 8 million because we can't culture and expand them. In and around the spine, we inject 25 million stem cells for larger areas and 12.5 million medicinal signaling cells in smaller areas. The source of the musculoskeletal pain, it can be multifactorial. It can come from many parts. Spine pain can come from actual disc. Spine pain can come from nerve roots that are being compressed. And it's important to get an MRI prior to any spine injection to clarify where the source of the pain might be coming from. We have some guests that have undergone surgery, and it's very important to leave this session understanding that much of regenerative biologics is injected perioperatively, meaning post-procedure, to decrease scar tissue, decrease inflammation, and help regenerate some of the treated tissues. If you've had an endoscopic microdiscectomy, there are parts of your disc that have been damaged and can inadvertently form scar. The exosomes, those are the small bubbles that come from stem cells, have dramatic influence in decreasing scar tissue post-operatively. So if you've had surgery, that's very helpful. If you haven't had surgery, these structural regenerative biologics can decrease the local inflammation. We also understand that pain in and around joints and discs can come from many sources. You've got pressure in the bone itself that can cause pain. You have inflammation of the joint space within. You have cartilage that has lost its cushioning power. You have chemical structures, we call them cytokines, that can cause significant pain. So it's very important to understand this central point. And if you have a bell, ding, ding, this is a take home. Regenerative biologics, medicinal signaling cells, stem cells, exosomes, PRP affect all of these sites. When we have osteoarthritis, either in the facet or in the joints, this is what cartilage looks like when it's torn apart and needs to regenerate. Here's a knee where you have bone spurs around the joint, you have cartilage that's lost, you have subchondral cysts, that's cysts in the bone, the pressure of which can cause significant pain. So we not only inject joints and in around soft tissues, we inject stem cells within the bone itself. My colleague in San Francisco, Rowan Paul, is world famous for perfecting the art of intraosseous injections of stem cells. Here you can see intraoperatively a knee where we're able to go into the knee, remove a core, and inject stem cells above and below the knee joint. And we can do this under general anesthesia. We can also do this while the patients are awake. And here you can see the structural device where we can deliver stem cells into the bone itself. This is what damaged cartilage looks like. And this is an important slide because we not only have to inject the joints above and below the joint, but intra-articular to help regenerate some of this damaged cartilage. This is the device we use. It's a reusable, injectable, where we pepper the surface of the bone with Novocaine, and then we're able to access the parts of the bone, and we can inject stem cells in the bone that find their way to the parts of the bone that are damaged. It's important for everyone, including our orthopedic physicians who are listening to this talk, to understand that we are now having excellent outcomes in managing stage 4 bone-on-bone osteoarthritis with this injection process. People are able to put off temporarily or sometimes permanently the need for knee replacement. We have a joint registry. We have thousands of patients in our denominator joint registry that are having excellent outcomes with this. Very surprising. Many of us have been telling patients that they aren't candidates for regenerative biologics if their joints have fully lost cartilage. This is not true. Question is, do regenerative biologics indeed regenerate intra-articular cartilage? Do they regenerate that cushion? The severity and duration of articular cartilage loss is indirectly proportional to the success of restoring the articular cartilage surface. So if there's severe cartilage loss, the chance of restoring that cushion becomes less and less. How about the success of total joint arthroplasty, total joint replacement in the hip, shoulder, knee? Well, historically, we orthopedic surgeons have reported 93 to 95% patient satisfaction. As it turns out, the true success rate in 2024, in the 21st century, is closer to 75%, meaning 25% of patients are wishing they hadn't had their joint replaced. So back to stem cells. We do have a pretty good journal article in 2022 called Adult Stem Cells for Cartilage Regeneration. I'd encourage you to look. It's free online and has an excellent bibliography. And that's the journal article in Cureus, C-U-R-E-U-S. Post-injection protocols. Here's another bell ringing. If there's something you need to leave, what happens after you do you inject? Do you go out on the beach in Puerto Vallarta or go hit the clubs that night at Guadalajara? Yes, it's okay to do that. If you've had injections injected into the skin, you might want to avoid sunshine. But an important part, and you should really know this, and this was a conclusion of all the world regenerative biologic specialists in Las Vegas a month ago, and that is you need to try to disperse as many of these stem cells and exosomes and platelets in as broad surface area as you can. And that is done with this device. It's called an acoustic wave device that helps disperse it more effectively. You'll see these advertisements for erectile dysfunctions for sexual function of men. This is very effective to help improve erectile dysfunction, but also if that probe is directly applied to the site of skin where you've had the injections, it will increase the diameter and increase the blood flow to better disperse and deliver your stem cells, your platelets, and your cytosomes more effectively to the disc and in and around the sites of your spine that need the stem cells. So that will conclude my talk. This is my personal email. If you want to take a screenshot of this, I'll leave this up. By the way, this is a bike ride I recently took from Banff, Alberta to Jasper, Alberta. This is one of the glacier lakes that I was able to ride my bicycle. It's about a 180-mile bicycle ride. Very beautiful. This particular lake is Bow Lake, about 80 miles into the ride. The other email you need to know is that at Cells Time clinics, and those are the clinics that we would like to encourage you to look more into in Guadalajara and Puerto Vallarta, soon expanding into Tijuana. Tijuana is a very popular place for Americans in that you can stay in San Diego and take a shuttle across the border and be able to get injections with cultured and expanded stem cells in Mexico. But I also have clinics affiliated with Cells Time in Cabo San Lucas and also in Cancun. All four places in Mexico are available. I have to go on record and tell everyone who's listening that I have spent a significant amount of time in the labs in Guadalajara and can give particular strong academic testimony that the culture and expansion process, as well as the aseptic process of procurement, processing, culture, and expansion, are extremely reliable and very safe. I've spent a lot of time with the lab. I'll be going to Guadalajara and Puerto Vallarta mid-September. If you are stateside, you have access in Utah and the state of Washington to stem cells that are limited in number. And that's why people are taking the time. As far as cost goes, costs are variable, and this probably is not the appropriate forum. But let's say that the costs in the United States exceed 4 to 5 times the expense you would pay in Mexico. Many of the stem cell treatment centers involve arrangements for flights, involve arrangements for lodging, and so that can bump the price. Most of my patients that come from the United States and Canada come and they make arrangements for their own lodging. And as far as cost range, it's in, for example, if someone comes with knee osteoarthritis, they can get a knee injection for 50 million stem cells in the range of $2,500 to $3,000, depending on what they want. Your insurance companies in the United States don't cover this. What else can I tell you? In the United States, it's very expensive to procure and inject your own stem cells. So it's a great option. And it's why I spend at least 3 weeks every quarter in some venue in Mexico, but I really focused on Guadalajara and Puerto Vallarta. That's the science that I've become very acquainted with. One problem one problem we're facing in the United States is we cannot transport cultured and expanded stem cells across country lines. That is against the law. I would lose my license if I did that. However, I can go to Mexico and provide these injections myself. I will also say we have multiple specialists at the Guadalajara Cells Time Clinic, very well trained, highly sophisticated means to not only provide IV injection, but some of our orthopedic specialists that are Mexico natives and Mexican citizens are doing intradiscal injections in Guadalajara. And I would strongly, if that's the direction you want to go, I have a few opinions about the necessity to inject directly into disc. And that is that if you go through the skin, there's a chance you might inoculate an aseptic, non-infected environment with some skin bacterial flora that can inoculate, colonize, and cause infections in and around the spine, which we want to avoid. So I think we've got a little time to perhaps entertain some questions. If not, I think you've got uh, these, and I'll stop screen sharing now, stop share, and entertain any questions that might come up. Sorry, I don't speak Spanish. I pretend in monosyllabic grunts to speak Spanish. Uh, Maybe some of my Spanish colleagues will help me as time goes by. It looks like we've got a few more attendees. Uh, if I'll go ahead and tap on allow to talk any of our guests. I'll go ahead and tap down there. And if you want to unmute, if you have any questions, I'm coming down here and tapping on everyone's that will allow to talk. And any questions that I can, please introduce yourself by name, where you currently reside, and any other thoughts. Have you all been unmuted? You've all been given the option to speak. Go for it.
I have a question.
Who's asking?
My name is Steve.
Hi, Steve. Where are you from?
I actually live in Puerto Vallarta.
Oh, excellent. Well,
Yeah.
good. We'll have to get acquainted, Steve.
Yeah.
And are you what's your past what is your professional expertise and your interest in medicinal signaling cells?
Well, I've had a few treatments myself at various facilities, mostly with outstanding outcomes.
Good.
And I'm actually putting a business model together now to try to help out. I'm a retired firefighter. So
good. Thank you for your service.
I'm putting together a business model to help out my brothers and sisters up in the States and in Mexico to try to educate them on these treatments and services to elongate their career and their retirement.
Oh, good. Well, what question do you have?
Well, I'm trying to figure out what facilities produce stem cells. The actual
I'm happy to tell you about that. I'm happy to tell you about that. A woman presents full term. They're thoroughly vetted regarding any disease that they have in the United States. No stem cells are allowed to be given with patients that have been vaccinated because of some of the stem cells that might have constitutive expression of spike protein from COVID-19. But the stem cells come from the placenta. The placenta is morcellized, and the umbilical cord is morcellized. This process in the United States takes about 6 hours. Of course, the laboratory where we process our placentas in Guadalajara, the stem cells are procured, isolated into a pellet, and then those pellets are put in culture medium. And over a 6 to 8 week period, depending on the amount of time necessary, we are able to culture, expand, isolate those specific cells, and then put them in cryopreservation in preparation for injection. The laboratories, I think it's a great point, that the laboratories must be certified. And I think anytime you do get an injection, you should speak to the practitioner to make sure they are very well acquainted where the stem cells come from, the appropriate procurement, processing, and culture and expansion done in an aseptic, very safe environment. So I've spent hours in our lab in Guadalajara as a Harvard-trained, Mayo Clinic-trained orthopedic surgeon to make sure my patients are getting the very best.
What's the name of the laboratory you work with in Guadalajara?
It's L Cells, L-CELLS, and they are the affiliate of the clinics, and the clinics are Cells Time. The Cells Time clinic that I use and I'm proud to use is in the Peninsula shopping area, in the Peninsula living area, there just 5 minutes away south of the Puerto Vallarta airport.
Oh, okay, okay. Interesting. Okay, well, you answered my question. Thank you.
Good. Any other questions or thoughts from our listening audience from the talk? There's got to be some. Go ahead. Introduce yourself.
Hi, I'm Carla, and I'm living in near Playa del Carmen, and have had a couple of, I don't know how to pronounce it,
Mesenchymal, yes.
mesenchymal, stem cell treatments, like 100 million in two separate, 100 million 9 months ago, 100 million a month and a half ago. In general, hoping to positively impact my lower back, where I have like stage degeneration, disc degeneration, without nerve. It seems like without nerve radiation. I haven't had good response for my back. Great, I feel young, I'm 54, but I'm thinking about, is there a more direct option to help improve my back that has been like, really in a bad state for the last, let's say, month and a half now.
And of course, it's difficult to provide a specific definition of and regimen description. Carla, what you want to be able to do is provide appropriate imaging for any practitioner that's going to be doing the injection.
Yep.
Number one. Number two, clarify severity and duration, and particularly, Carla, how it's affecting your activity, either recreationally or vocationally there in Playa del Carmen. Even as important as the injection is the post-operative protocol. If you do not have access to an acoustic wave, you should find acoustic wave, shockwave therapeutic post-injection. You should. You need to clarify what the source of your spine pain is. Is it intradiscal? Is it compression of nerve roots that radiate down your buttock or out to your arms? Or
it's the disc
all
compression.
localized.
Yeah.
Disc.
It's lower. Yeah. So, and I've done physical therapy and chiropractic, and kind of just running out of options and not seeing a lot of improvement. So that's why I'm like, the clinic that I've gotten the stem cells from doesn't do that type of targeted treatment. So I'm, opening my net wider to see.
How did you get them? IV?
IV. Mm-hmm.
Okay. Now IV is great. Now you have to understand, if you're getting stem cells IV, it's given to you in your antecubital fossa of your elbow, and many of the stem cells are caught up in the right heart, specifically the lungs. You have options. I'm more of a kitchen sink solutions based orthopedic surgeon, where if you're going to inject stem cells or cytosomes or PRP or alpha-2 macroglobulin, you're going to want to inject it directly in and around the site that needs attention. And that will help distribute the more effective regenerative biologics specifically to that area. I'm sure some of those some of those 100 million stem cells you received IV, or maybe you weren't the one, but if you received them IV, many of them did not reach their target.
Yeah.
So, and again, I can't overemphasize the post-injection protocols.
And so how long does that protocol happen? So if I went to, let's say, Guadalajara, Puerto Vallarta, wherever that needed to be, is it like, oh, you just stay for a day or 2 days, or is it like you should have this therapy over the course of a week to keep things moving? Maybe
it would be once a week for 6 weeks post injection. That's what we're doing in the United States.
Okay.
So whatever you do, you'll want to make sure that you're getting those acoustic wave therapies after.
To optimize, yeah, because it's an investment, even though it's in Mexico and it's significantly cheaper than usually Panama or the US, and US is your own stem cells. Nobody wants 54-year-old stem cells. But, thank you for
Carla,
the information.
Yeah, you're very welcome. Thank you for joining us.
I'm definitely I'll follow up with you and figure out what I can do.
Very well, very well.
Thank you.
Any other thoughts from our listening participants and attendees? With that, I will send my heartiest thank you for joining us. I hope it's been informative. If you have any questions or concerns, that's my personal email. And then if you want to contact Cells Times Clinics in Puerto Vallarta and Guadalajara, if you want to make arrangements for Cancun, say Carla, for those who are in places like Playa del Carmen or in Cabo San Lucas, we can make arrangements for that. There are particular times that for example, I'll be in Cancun, available to do any injections the last week of January, and I'll be in Cabo San Lucas on New Year's Day and thereafter. And then I'll be in Guadalajara and Puerto Vallarta mid-September. So we've had great successes, even more exciting information. This is technology that's here to stay. It's no longer hand-waving guesswork. We now have a huge joint registry and denominators in the United States that are proving the efficacy of these particular modalities. So with that, I'll bid you all adieu, and any other questions, please submit them through the email. Thank you very much for joining us. Have a nice evening wherever you are in the world.